Okay, again, thank you everyone for jumping on for the kickoff for 24-25 already, which will actually start August 27th. So we're almost to the end of our year 3. And here's the agenda. We've got a
It's not sharing, Becky.
oh, well, let me back up one.
Yep.
There we go. Got ahead of myself. Sorry about that. Okay, can everybody see the PowerPoint now?
There you go.
Okay, again, thank you everyone for joining us. We'll go ahead and get started. Here's our agenda. We've got a full agenda with a lot of good information.
It's not tracking you, Becky. Did you share the right screen?
I thought
Did
it
I go back to the PowerPoint's up? You seeing that one right there?
Is that the right one?
Hang on 1 second.
Yeah,
Logan. That's not doing the display though. No, it's not following. It's not going forward.
Wonder why. Okay, so let me get out of this. Yeah. Okay. So we're going to record this again. Apologize for the technical difficulties. So we do have a packed agenda. So we'll go ahead and get it started. Okay, so we wanted to show for the last 4 years where we started to where we're going to be for 24-25 with our subrecipients. And you can see how the last 4 years we have grown. So we are up to 20 subrecipients this year. So, and our new recipients are highlighted. So Mosaic Life Care, St. Louis Integrated Health Network, and SWOPE. So we would like to welcome you to year 24-25 of the Navigator Grant.
So I hear bits and pieces. So definitely be like, Angela.
Okay, and so we thought it would be good to go back and talk about the purpose of the Navigator Grant and what the Navigator role is. First of all, the Navigator Grant is funded by the Centers for Medicaid and Medicare to organizations who serve as navigators in the federally facilitated marketplace. And the role of the navigator is to help consumers with applications, with the marketplace, and other insurance affordability programs. The navigators will provide education and outreach to raise awareness about the marketplace and refer consumers to other health insurance programs. And that's something we're really going to focus on this year, is doing the outreach piece to this, because that's the navigator's role, is education and outreach. So we really want our navigators to be thinking of outreach as far as, are they going to be going to health fairs? Are they going to be going to meetings with like-minded entities to help look for those people needing enrolled in the marketplace? There was 300,000 Missourians that lost Medicaid this past year. So we know that there is a lot of people looking for health insurance. And so we really want the navigators out there beating the weeds, trying to see if they can help those people. And they do this year round. This isn't something they do November 1st through January 15th. Navigators are working with consumers year round to get enrolled in the marketplace and other health insurance programs. And then organizations that receive funding to serve as FFE navigators must carry out a minimum of all navigator duties required by the ACA. And so at this time, I would like to introduce Kelly with Novella, and she will talk about the things that Novella can do for the subrecipients.
Hello, everyone. As Becky mentioned, my name is Kelly Klinken, and I'm the Director of Client Engagement at Novella Brand House. And we will be running through the marketing strategy for this year results and a little bit of what we have planned for the upcoming grant year. I will also be introducing Shannon O'Brien throughout as we get into the presentation in a little bit. She is handling the PR component of our marketing strategy. And starting out with goals and then KPIs. So our goal for the grant year was to reach at least 700,000 consumers with information about available healthcare coverage options. So within that, we really wanted to drive traffic to the Show Me Coverage website for further information, how to reach a navigator. And we really wanted to just boost the overall brand awareness of the Show Me Coverage services. Okay, so how are we going to measure these goals? So we're going to measure these goals through our digital campaign, reach, engagement, impressions. For social media, we could have also been measuring follows and likes. And then, of course, website traffic through Google Analytics, Instagram, and Facebook Insights. Okay, so I'll just present, I'll kind of give you a snapshot of what we did for the 2023-24 marketing strategy. Starting with our paid media. So we ran a very comprehensive digital campaign. So this is going to be a highly targeted display banner ads. So these are ads that we're targeting our audience. So of course, Missourians, 18 years old plus, that are underinsured or have no insurance coverage. We also had we were reaching the entire state of Missouri, but we did have 3 key markets that we were reaching. So we were reaching Kansas City, St. Louis, and the Springfield area. However, we were also tasked with trying to reach as many Missourians as possible in both suburban and rural communities. So we definitely had a pretty big, task in front of us, but I really think we delivered on that through our digital campaign because we could have the biggest reach. So we did this through display ads and then also through Facebook and Instagram ads. Probably not so surprising, Facebook ads did extremely well through this campaign. And then we also utilized outdoor. So these are going to be billboards in our key markets, Kansas City, St. Louis, and then Southwest area, Joplin and Springfield. We also utilized transit advertising. So this is going to be advertising on buses, bus shelters, signage around where like bus stops, and very highly effective. And that was in the St. Louis and Kansas City market. And then also utilizing a little bit of print advertising. So kind of thinking, very traditional advertising to reach Missourians southeast, so that Cape Girardeau area, and then the Hannibal Courier Post, so around the Hannibal, Missouri area. And again, our kind of thought process with this print advertising specifically is really just trying to reach those consumers in the more rural populations where we know that they are reading those local papers. You kind of don't see that as much maybe in more of those, urban type areas. So definitely, digital outdoor transit advertising was a better fit. but we did want to do a little test market with the print advertising as well. Okay, so campaign results. So if you think back to our goal, we had a goal of 700,000 impressions. So we absolutely blew that out of the water alone with our digital campaign. So this is measuring the display ads and social media ads. We had over 11 million impressions. So impressions, think eyeballs, that is like number of people that saw that ad. Clicks. So this is where it gets interesting because now people are seeing the ad, but now they're actually clicking on it. So that our click-through rate was 0.37%. That is the average, the national just industry average is 0.05%. So we definitely met that and then some on the click-through rate, just industry level wise. Engagements. So this is where not only are people seeing this ad, but now maybe they have clicked on the ad or maybe not even clicked on it, but they're hovering on the ad, or in the instance, if there was like a video, maybe they watched the video for 10 seconds. So that's how you can think about an engagement. And then engagement rate on that was 0.39% and about the same for an industry average, again, about 0.05 to 1%. Billboard, so our total impressions, so this is, again, think just eyeballs like drivers driving by, was 9 million impressions. We had some great bonus time. So while it does say for 4 weeks, that's actually probably maybe 6, 7 weeks total, just because on some of the boards in the Kansas City area, we actually got more time than what we had originally allotted because they didn't have an advertiser coming in. So they left show me coverage at, which is wonderful. Now on the transit ad, so again, this is for the bus ads, bus shelter ads. We had over 1 million impressions on that as well. And then I did want to turn it over to Shannon for right now and just to walk us through, introduce her from Page Communications, and she can just talk to us about PR.
Hi, everybody. I think everyone on here has gotten my emails and knows at least my name, but I'm Shannon O'Brien with Page Communications, and we've been working on the PR for the MPCA Navigator Grant the end of last year and this year, and we have gotten some great coverage, especially in St. Louis, Kansas City, and in the Springfield area. We have gotten news stories done about general Medicaid coverage, events like the Thanksgiving turkey giveaway in St. Louis. We had a great response from media inquiries and stories from the HIV/AIDS Awareness Day. And then recently Medicaid premiums that resumed. We did some stories before that to let people know they would need to start paying for their Medicaid premiums on the different programs that, were requiring that. So we've gotten some great coverage and also with KSIS Radio and their website, which is in mid-Missouri and does reach some of the more rural areas. They have a powerhouse website, which is a place where a lot of people in the rural areas in mid-Missouri go to find news and information and things. And they have been kind enough to post some of the media releases that we send out. So it's been great, but we would like to do more in this coming up year. And I know sometimes it's difficult and it seems like a big ask for patients to be interviewed and people, but really media is interested in stories of real people because that reaches more people and it gets a better result. So we will be looking for that coming up in the next year, compelling stories with real people, patients, families, etc. We would also like to set up some stories for news crews to go out with the navigators into the community to do outreach and see what that is like as well, because I think that really goes to speak well for the health centers and what you all are doing to try and reach as many people as possible and really dig into the communities. So I'm going to be sending out an email to all of everybody in this new 2024-25 Navigator Grant. I'm reintroducing myself, saying what we're looking for. and giving you some things that we have planned for next year for coverage, so we can maybe hop on it early. A lot of the media things are last minute, and I know that's difficult too, but that's kind of how the media works. When they decide they want to do something, they want to do it today or tomorrow or right away. An example of that is right now we've got some interest in the media to do some stories about back to school in St. Louis and Kansas City, because school starts on Monday. So they want to just talk to health centers and families about getting their kids their checkups or their immunizations before school starts. So we're working with some health centers in Kansas City and St. Louis to get that done. KSIS has also agreed to put some information on their website. So, you know, it's a constant content generator that we're trying to create here. So I'm happy to talk with anybody individually about what we can do with you and your health center, you know, kind of kick around some ideas, answer any questions. So my information will be on that email that I send out with kind of what's coming up for this year.
Great. Thank you, Shannon.
Thank you.
And then just a few kind of items that we're kind of looking for the next grant year. So what's coming up? We would absolutely love to produce 15 and 30-second videos. I think this would be a great way to explain what Show Me coverage is, what the navigators do, and how important it is. And we would love to obviously use those for social media and for a paid campaign. Expand the digital campaign. If we have video, we would love to do streaming, possibly advertise on other channels like YouTube, really diving in to that CTR and that engagement rate, and would absolutely love to increase that for the next year. And I think video would be a great way to do that. So really taking our findings and diving into that. Billboard did great last year. So I would love to expand into different locations, possibly more rural locations as well. And again, just identifying additional key markets, additional, you know, our three big ones are always going to be, you know, Kansas City, St. Louis, and Springfield, but really trying to see where else we can really dive into and help spread out our funds a little bit more. And with that, I thank you. Please reach out if you have any questions or have any additional questions about any of the campaign or the results or anything that I talked about today.
Thank you, Kelly. Thank you, Shannon.
Thank you.
Okay, so Kelly had mentioned Show Me Coverage. Show Me Coverage is a project of MPCA to help Missourians enroll in affordable health insurance through the marketplace and Medicaid. Here is the link, and this is what the page looks like. You can go, the consumers can go up here and they can put their zip code in and they can select what region they're in, and it brings up the subrecipients. So I think this one, I can't read it, maybe Central Ozarks, but you know, over here it could be Access or Fordland, St. Louis area. It could be, you know, Care STL, FCHC. So this is really an asset. It's really good and very user-friendly. Yeah.
Sorry,
I was just going to jump on really quickly. So the Show Me Coverage website right now is what you see on your screen. We are in the process of redesigning, redeveloping this website with Novella, with Kelly. And so what we plan on having is more of a Google map that will show up with the red markers of all locations in the state that have navigators available. And then your logos for each one of your entities will be located at the bottom of the screen. So folks will be able to see which participants there are in this grant. If they're local, they can send information to family members to also contact navigators. And then the phone number that's included on the Show Me Coverage website actually goes directly to Becky. So it's not any sort of automated service. It's not just a random person that's answering. It's Becky that this goes to, which is thanks to Becky. That's all I'll say. Thanks.
Thanks, Katie. Okay. Moving right along. There we go. Okay. So this is just a snapshot of year 3 and everything that the navigators has done up until the end of July. We actually don't have August numbers in there. So, and these are the grant goals. So the first one here, consumers reach through education and outreach. It goes up to 100,000, but the actual number was over almost 1.5 million, and it probably will be by the end of the grant year. So you can see this is an incredible amount. Oh, yeah, this is the actual reported number. So to us, the navigators reported this number to us in their weekly report. So that's where these numbers are coming from. And then one-on-one assistance. This is where navigators have conversations with consumers. So last year it was a little over 24,000. This year, it is over 123,000. So you can see where the navigators are working extremely hard and really reaching out to the public. The next one is QHPs. That is our marketplace enrollment. And right now that number is down a little bit. And so that's why we are really going to refocus on this goal and get out there and try to help consumers with marketplace applications. Medicaid and CHIP assistance, last year it was 11,000. This year it's over 23,000. So that tells you, more than doubled. So, and then navigators helping consumers understand their health insurance. Last year, it was almost 25,000. This year it's over 107,000. So this tells you the importance of your navigator staff, your outreach staff, getting out there. They're working with those consumers and helping them get their healthcare needs met. Great job. Okay, and so you saw at the first of the meeting that we have grown. We now have 20 subrecipients under the Navigator Grant and 60 navigators. So as this is growing, we've had to kind of restructure how we do things. And so we're going to be leaning on our supervisors more. And we did meet with all of them yesterday and reviewed all of these changes so that they would be aware of it before today's meeting. So this is very important. Subrecipients cannot invoice for navigator time until all requirements below are met. So the conflict of interest. Supervisors will submit the conflict of interest in one email for all of the navigators. Each year, the navigators have to sign a new conflict of interest. So rather than getting 60 emails, we want that in one email from the supervisor. And when a new navigator comes on, they also have to sign a conflict of interest. This has to be done before their navigator ID can be assigned. And so we've created a new onboarding process that allows for 4 weeks for training and onboarding to be completed. The navigator certificate, so the navigator has to complete their CMS Navigator training and print out their certificate. We want this to be submitted by the supervisor and not the navigator. That way, the supervisor will be aware of where the navigator is at in the training process, or the onboarding process, sorry. And then the navigator license, again, we want that submitted by the supervisor and not the navigator. So the supervisor is on track with where the navigators are. And then CMS Navigator training. Returning navigator certification must be completed by October 1st annually. So right now that training has gone, as CMS calls it, it's gone dark. It's not available for the navigators. They do this every year. They take it down and then they put up the next year's training. As soon as the 24-25 training is available, we will let you know. But currently it is in the dark. And so every navigator certificate expires October 31st of that year, everybody. So license, you do your license every 2 years. So, and then going forward, Supervisors will oversee the onboarding and certification processes. There again, we have a very robust onboarding plan that we went over yesterday, and we will be sending out all of that information to the supervisors shortly. Okay, so invoicing. Invoicing, last year we started with uploading invoices to the OneDrive, same as this year. They are due no later than the 5th of every month. So, and use the template that is provided to you, Exhibit M, and please do not alter the template. It makes it very hard to go in and if a change has to be made or anything. But also another very important thing, please make sure that you're putting your subrecipient name, completed by, month, year, and there needs to be a unique invoice number. Some subrecipients, their invoices are very similar every month, and it can get very confusing if there is not a unique invoice number on every invoice, and then the date that you complete it. And then if you notice down there, it says other, and then please itemize. If you have to put something under other, please list it out. We're going to need that information. And then our outreach team will meet with the subrecipients in February to review remaining funds. There's a lot of funds. CMS wants no funds left on the table, so we like to meet with our navigator subrecipients and make sure that they're going to be able to use their funds. And if they, need direction on how to spend them, do it then. So you will be getting an invite for that. And then our navigator trainings, we can do these on-site or virtually. So we are able to come to the health center and work with your outreach staff. We can do the dashboard training, which has the weekly report, training videos. It's got information about how you can get your license and Medicaid information, marketplace information. It's got a lot of information on there. We've tried to create a one-stop shop for our health centers so that they're not trying to bookmark 100 different websites. And then, of course, the big one, famous Metis provider portal. Again, we can do those virtually or on site. If you or your health center is needing, subrecipient locations, if you're needing help with that, just let us know. And then here is the link to the dashboard. This is the MPCA outreach page, outreach and enrollment page. Here is the password for the weekly report. And then this is a big one. Reports are due every Friday by 10 a.m. unless otherwise instructed by MPCA. So if, we're going to be off on a Friday for a holiday, we might request that those get submitted on Thursday. Navigators can turn those in early. That's fine. If they're, going to work Monday and Tuesday and the rest of the week be on vacation, they can submit those reports early. It's just, we need them reports in by 10 a.m. because then our team has to submit a report to CMS. If those reports are not submitted by 10 a.m., those numbers will not be counted towards your grant goals. So keep that in mind. And you cannot, if you didn't report numbers this week, you cannot add them to next week's numbers. It doesn't work that way. Okay. And so last year, we realized that not only do our navigators have to have a license, but our subrecipients are required to have a business entity license. These licenses are renewed every 2 years, and it is the subrecipient's responsibility to know when those licenses expire, and we have to have a current copy of your current license, so it has to be current. So, yeah. And then your navigator certificates expire the 31st annually. Navigators have to recertify annually. So this is what they do every year. They also need to make sure when they are selecting their training that they're picking Navigator. And then when they print out their certificate, it needs to say Marketplace Navigator, not Certified Application Counselor. Here again, the Navigator Missouri state license. It's renewed every 2 years, and it is the navigator and the supervisor's responsibility to know when it expires. And then navigator meetings, starting out with the new, when open enrollment starts, we will be meeting weekly with our navigators to see if, they're having issues or anything we need to be discussing and sharing out as a whole team. And then we will go to bi-weekly. And so we would appreciate it if all navigators and supervisors can attend those meetings, because there is a lot of important information, not only about the marketplace, but about Medicaid as well. And then we will do monthly and bi-monthly check-ins with each subrecipient. And there we will review grant goals and discuss questions or concerns specific to your organization. And then outreach staff will meet with subrecipients in February to review where you're at the half point mark. 6 months in, you should be halfway to your grant goals. So if you have 50 marketplace applications put down for your grant goal, 6 months in, you should be at the 25 mark. So, and then dates to remember. So the CMS Navigator Grant for 24-25 starts August 27th. So here in just a few days. And then the CMS training, it has to be completed by October 1st, even though their certificates October 31st. This is CMS's requirement, not MPCA's. So, and then Navigator Conference, we will have a conference on September 19th in Jeff City at the Marriott. Supervisors and navigators need to attend this. We will be sharing a lot of important information, and it would be very beneficial to them. And then open enrollment will start November 1st and run through January 15th. And then here is our emails if you guys need to reach out to us. Okay. Thank you again for attending. And we'll open it up. So if you guys have questions or comments, please feel free to unmute and ask.
Will you be sending slides?
Yes. Yeah.
Thank you.
And for
Thank
the
you.
newer subrecipients, we will meet with you and go in depth over the OneDrive and more and
Super.
how the Navigator Grant works, the ins and outs of the Navigator Grant. So we will be reaching out to you.
Okay, great. Thank you.
Uh-huh. Well, if you don't have any questions or have anything you would like to share, again, thank you for jumping on, and we will get this information out to you just as quickly as we can. Thank you.
Thank you, Ms. Becky.
Thank you.
Bye. Thank you.